Hello everyone. Today, we're delving into the world of a medication called ProAir HFA, commonly known by its generic name, albuterol sulfate. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: ProAir HFA, or albuterol sulfate, is an inhalation aerosol medication that belongs to the class of drugs known as bronchodilators. Its primary function is to open up and relax the airways in the lungs, making it easier to breathe. ProAir HFA is typically prescribed for the treatment and prevention of symptoms associated with asthma and other respiratory conditions, such as chronic obstructive pulmonary disease, COPD. It works by targeting the smooth muscle cells in the airways, which helps to relieve bronchospasms and improve airflow. Warnings: before using ProAir HFA, it's essential to be aware of certain precautions. This medication should not be used as a first-line treatment for acute bronchospasm or asthma attacks. It is designed for regular use to manage chronic respiratory conditions and to prevent exercise-induced bronchospasm. If you experience sudden and severe breathing difficulties, seek immediate medical attention, as this may indicate a more serious condition. Before using ProAir HFA, inform your healthcare provider if you have a history of heart problems, high blood pressure, seizures, diabetes, or an overactive thyroid gland. It's crucial to disclose all medications you are currently taking, including prescription drugs, over-the-counter products, and herbal supplements, as there may be potential interactions. Pregnant individuals and those who are breastfeeding should consult with their healthcare provider before using ProAir HFA, as the safety of this medication during pregnancy and breastfeeding is not fully established. Before starting this medication, your healthcare provider should also be informed if you have ever had a hypersensitivity reaction to albuterol or any other ingredients in ProAir HFA. Side effects: like all medications, ProAir HFA can have side effects. Common side effects may include nervousness, shaking, tremors, headache, rapid heart rate, tachycardia, or increased blood pressure. These side effects are usually mild and temporary. In rare cases, ProAir HFA may cause more severe side effects, such as chest pain, irregular heartbeats, arrhythmias, or worsening breathing problems. If you experience any of these serious side effects, seek immediate medical attention. Interactions: ProAir HFA may interact with other medications, so it's important to inform your healthcare provider about all the drugs you are taking, including beta blockers, diuretics, or other bronchodilators. These interactions can potentially affect the effectiveness and safety of ProAir HFA. Dosage: the correct dosage and usage instructions for ProAir HFA are crucial for its effectiveness. Always follow your doctor's recommendations when using this inhaler. The typical dose for adults and children over 4 years old is 2 inhalations every 4 to 6 hours as needed for relief of symptoms. However, the specific dosing instructions may vary depending on your condition and your healthcare provider's guidance. Avoid: while using ProAir HFA, it's important to store the inhaler at room temperature, away from heat and direct sunlight. It's also recommended to keep the inhaler clean and properly maintained according to the instructions provided with the medication. FAQ: many people wonder about the appropriate age for using ProAir HFA. Generally, it is safe for individuals aged 4 and older, but the specific age for starting treatment may vary based on your doctor's assessment and the severity of your condition. Closing: that concludes our overview of ProAir HFA. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns related to this medication. Thank you for tuning in.